Come in.
Hello.
Hey.
Good morning, James.
Good morning.
How are you feeling?
All right.
How'd you sleep?
Pretty good. I woke up once or twice, but I'm okay.
Did you? Okay. I know they had to wake you up a couple times to get your vital signs last night.
Right.
Well, it's good to see you again.
Thank you.
Obviously, I'm here to continue your examination from yesterday, so
Okay.
we have a couple things that we need to go over, and
Okay.
then we can get started with today's portion of the assessment. So I did speak with your night shift nurse. She said your vital signs were stable overnight. There was nothing, no major changes really. Your blood pressure was still running a little bit high, so we will continue those Q4 vital signs for now.
Okay.
You did really well up and down to the bathroom last night. You voided normally. Your output was great. How are you tolerating your diet? It looks like you ate a good percentages of your meals, your dinner tray.
I did.
Okay. Perfect. So why don't we go ahead and get started with just the basics here. I'll have you confirm your name for me.
Sure. James Monroe.
And your age.
30 years old.
Good. And tell me why you're here today.
I'm here for checkup after being in a car accident.
Very good. Okay. So the only update I'm going to do from last night is I'll go ahead and upgrade you to an independent, so you can go ahead and move around on an independent basis. You don't have to call for help to go to the bathroom, okay? So that'll give you a little bit more freedom.
Thanks.
Okay. How is your pain, or how was your pain, I should say, last night? Was it tolerable? Was it uncontrolled?
It was tolerable. It was
You
about
feel
the same.
like the Tylenol was okay? Do you need something heavier?
I don't think so. My pain did not increase.
Okay.
So I think I'm okay.
So we'll stick with the Tylenol Q6 for now. Your neurological assessments were done Q4 hours, and all of that was normal with what we did originally. So no changes so far. We're not seeing any decline, which is great.
Good.
Can you tell me what your current pain level is?
A 2.
Okay. Any new discomfort anywhere? New soreness, stiffness?
No, I can't say
About the same as yesterday?
Yes.
Do you have a headache right now?
Very slight. Just a slight dull ache.
Okay, so an achy.
Yeah.
Can you tell me where it is in your head? Point to where it is.
It's like here from neck, maybe to the top of my head.
Just on the one side?
Yeah.
Okay. Any burning sensation anywhere?
No.
Numbness?
No.
No tingling?
No.
Okay. And how is your vision doing? Any blurry vision or double vision?
No, my vision's okay.
Okay. And then no loss of vision, of course, overnight. Okay. No. And I did have you steering away from screens just for the concussion diagnosis, so you did okay with that.
Yes, I did.
So I would say today, after our exam, we can maybe start implementing screen use a little bit at a time, but I'll see kind of how it goes.
Okay, good.
Any ringing in your ears overnight?
No, none.
And no loss of hearing?
No.
Any loss of smell or odd smells, smelling something that's not there?
No.
Loss of taste or odd taste?
No, no odd taste.
And your appetite, like you said, is doing okay?
Yes, it is.
No nausea or anything like that overnight?
I'm not nauseous.
Okay. All right, James. Well, we can go ahead and get started with our examination.
Okay.
So for today, we're going to be doing a pretty basic head-to-toe assessment. This is going to kind of rule out any major injuries that you might have had in the accident that we might have missed, as well as testing some kind of reflexes and neurological functions.
Okay.
And then tomorrow, we're going to do a sensation test, and that's going to completely rule out any neurological deficits. We want to make sure that there are no spinal cord injuries, that there's no loss of sensation anywhere in your body before we discharge you, okay?
All right.
So let's go ahead and get this done today. How did baby cat do overnight? She's enjoying her stay?
Yeah, she is. She's very curious.
Okay, very good. So let's start with your pupillary reflexes. So let me just get a pair of gloves on.
Okay.
Okay, so let's go ahead and get started by checking your pupillary reflexes. We did this yesterday, so I want you to look straight ahead for me. So yesterday I noticed a very slight delay in reaction, and today it looks like that has subsided, which is great news.
Okay.
So it might have just been a slight muscle delay since you did have a concussion, but I'm not seeing that today. I just want to make sure. So I'm going to bring this in real close. Just look straight ahead for me.
Sure.
Look down. Looking for any flutters or twitches in the eyelid. Go ahead and look up. Very good. So I would say the delay in reaction there has subsided, which is good. So not worried about any injuries to your pupils. Okay. So I do want to just check for any signs of swelling. We did a measurement yesterday. I'll go ahead and redo that now. Like I said, we're just checking for any intracranial edema. We're still at a 25, so that's good. Changes there. All right, James, so I would like to get started with an eye exam at this time, if that's okay with you.
Sure.
So I have a couple basic things that we will test. And why don't we go ahead and get started with an acuity test. So I have a Snellen chart here. You've probably seen this before.
Yes.
I want to have you look this over for me. And let's see, I'll just use this little tool here to make it easier for you. So I'm going to point to a couple letters. I want you to look with both of your eyes to start, okay?
Yes.
So can you tell me what this line here says?
Sure. D H J B S.
Here.
E P T Z O C F D H J L T F P H.
Very good. Can you tell me what color this is?
That's red.
And do you see this number here?
I do.
What number is that?
Number 9.
Very good. So we're going to repeat that test. This time I'm going to use an occluder.
Okay.
So this is going to cover one eye. You can choose which side to start with. And we're going to try repeating that test, okay?
Sure.
So can you read this line here?
Sure. D H J B S E P T Z O C F D H J L T F P H.
Very good. Go ahead and switch eyes for me. Okay.
All right. D H J B S E P T Z O C F D H J L T F P H.
Very good. And are you able to see any of the numbers here?
Yes, I can see them all.
Can you tell me what this number is?
6.
And what color is this?
That's green.
Very good. So your acuity is 20/20, which tells me a couple of things. Your glasses are up to date, and there's no loss of acuity secondary to your accident, which is wonderful. The next thing I'm going to do is test your color vision, or testing you for color deficiency. So this is an Ishihara test book,
Okay.
and you'll see several test plates with different colors, and I'll ask you various things about them, okay? So for this first one, can you tell me if you see a number here and what it is?
Yes, I see the number 12.
Perfect. And do you see a number here?
Yes, number 8.
In here?
Number 5.
Good. And can you tell me what color the outside of this plate is?
Yes, it is green.
And what color are the numbers if there are any?
Pink and red.
And what number do you see?
29.
Same thing here. What color is the outside?
Orange.
And the
Red.
number?
The number is 74.
And what color is the number?
It's green.
Very good. What number is this?
Number 7.
Good. And here?
45.
Very good. Do you see a number here?
Yes, number 16.
Do you see a number here?
No, I don't.
Do you see anything here?
Yeah, there's a snake-like pattern.
Can I have you take this in your hand
Sure.
and trace that for me?
Sure.
Very good. lastly, do you see a number here?
Yes, 35.
Can you tell me what colors you see?
I see red, purple, pink, and also black and gray.
Very good. Okay. So no suspicion of color deficiency or loss of acuity in your vision, which is wonderful.
Good.
Any difficulties with that? Blurry vision, double vision, anything abnormal or uncomfortable?
Nope.
Perfect. Just gonna mark a couple things down. Your cat is very well behaved.
She's doing well today.
So the next thing I'm going to do is have a look in your eye. And to do this, I will be using a tool called an ophthalmoscope.
Okay.
So you might have had this done like with your optician.
Yeah, it looks familiar.
Essentially, this just allows me to look inside your eye, get a little bit of a deeper look. Excuse me while I just get the right setting here.
Sure.
So what I'm going to have you do initially is just look straight ahead for me, okay? I will be getting fairly close to your face, so I apologize for that.
Sure.
Perfect. So I'm going to put a finger out,
Okay.
and I want you to just focus on my finger, okay?
Sure.
I'll move as I move it around. Wide eyes. There you go. Perfect. So I'll do that on the other side as well.
All right.
So firstly, if you could just look straight ahead for me.
Sure.
Good. And I'll place a finger out.
Okay.
Very good. Okay. Seemingly no abnormalities there. Did that cause you any discomfort?
No, it did not.
All right. Very good. Okay. So now I am going to palpate kind of around your tear ducts. Is it okay if I remove your glasses?
Certainly.
Okay, so we'll put these back on in just a second. I'm just going to set them next to you.
Okay.
So I'll just be very gently pushing around your sinuses, around your tear ducts, feeling for any signs of abnormal inflammation. I do want you to tell me if this causes you any discomfort.
Okay.
Okay, any pain or discomfort there?
No, none.
Okay, so keep your eyes closed for me, just some very gentle palpating of your eyelid. Good. Okay. Alright, so what I'm going to do now is called the follow the light test. And I'm just going to move the light around in various positions. I just want you to follow it eyes only. Try to keep your head pretty midline with your body, okay?
Sure.
So let's start with your head about here.
Okay.
Can you see the light okay?
Yes, I can.
Perfect. Eyes only. Good job. Perfect. Any blurry vision, double vision?
No.
Okay. So what I'm going to do now is a little bit of a mind trick here. I'm going to have you look at the light. Now look at my fingers. Look back at the light. Down at my fingers. Back at the light. Good. Look at the light. Look at the light. Fingers. Good job. Okay. Acuity card was normal. Okay. So let's go ahead and test your peripheral vision. I have a couple things to test that with here. me what color this is.
Purple.
Let's use this here. While you hold on to that, occlude whichever side you prefer to start with. Can you see this?
Yes.
Okay, so I want you to follow it with your eye until you no longer see it.
Okay.
Do not move your head, okay?
All right.
Tell me when you no longer see it.
No longer see it.
Perfect. Tell me when it comes back into your field of vision.
It's back.
Tell me when it disappears.
Disappear.
Reappears.
Reappeared.
Disappears.
Disappear.
Reappears.
Reappear.
Disappears.
Disappear.
Very good. Reappears.
Reappears.
Disappears.
Disappears.
Very good. Okay, go ahead and switch eyes for me. Can you see this okay?
Yes.
Can you tell me what color it is?
It's green.
So we're going to repeat the same test, okay?
All right.
Tell me when it disappears.
Disappears.
Reappears.
Reappears. I'm sorry.
Disappears.
Disappears.
Reappears.
Reappears.
Disappears.
Disappears.
Reappears.
Reappears.
Disappears.
Disappears.
And reappears.
Reappears.
Very good. Okay. So can you tell me, with both eyes open, which of these, if any, you would say is darker?
The one to my left, your right.
And what color field are they in?
Green color field.
Very good. Okay, so lastly for your peripheral vision, I'm going to have you hold this with the occluder down. And tell me if you can see my fingers here.
Yes.
Can you see them here?
Barely. No.
How many fingers is this?
2 fingers.
Now.
3 fingers.
Now.
4 fingers.
Now.
2 fingers.
Now.
1 finger.
Go ahead and switch for me. Can you see my hand here?
Yes.
How many fingers is this?
2 fingers. I can't see.
Here.
3 fingers.
Good.
1 finger. 2 fingers. 4 fingers. 5 fingers.
Very good. Okay. Was that test difficult at all for you?
No, it wasn't.
You did very well. So no issues with your peripheral vision at all. All of your visual fields are open, okay?
Good.
She is just so well behaved, I can't even believe it. Alright, so let's go ahead and move on to a nose and oral examination.
Okay.
So I am going to just have a brief look here. I have an ophthalmoscope, and this is just going to allow me to visualize your nasal patency as well as your oral cavity. So if I could just have you tilt your head back for me slightly. Just looking for any obvious signs of occlusion. Okay, can you open wide for me? Say tongue to the roof of your mouth and down to the bottom palate. Stick your tongue out wide. Very good. Okay. So let's go ahead and proceed. I'm going to start by occluding one nair at a time. So
Okay.
essentially one side of your nose.
Sure.
Take a breath in for me. Good. Again. Any feelings of occlusion there? Are you able to breathe normally on both sides?
Yes, I can breathe normally.
So I have a couple different things here that I'm going to use to test your sense of smell. I want you to just give me your best guess what it is, okay?
Sure. Lavender.
Very good.
Lime.
Good. Last one.
Mint.
Good job. Okay. Now I'm going to test your sense of taste. So I'm going to drop a few droplets of a substance onto your tongue, and I would like you to tell me what you think it is, okay? It's going to be a very common taste, nothing super obscure. You should be able to guess what it is, okay? It is very cold, I apologize.
Salt water.
Yes, I'm sorry. It is salt water. That is sterile saline, so it's very salty. Okay. Very good job. All of that was within normal limits. Nasal patency is normal. Smell test and oral examination were all within normal limits. So let's go ahead and move on to a hearing exam. Alright, James, so I'm going to start by having a brief look in your ears.
Okay.
So if I can just have you look all the way to the side for me.
Sure.
Very good. And let's do that the other way. Good. Okay, so no obvious signs of occlusion there. Just looking for any excess cerumen or earwax that may be protruding outside the ear canal. So let's go ahead and move on to a brief ear exam. You said you're not having any issues with your hearing at this time.
I don't think
You
so.
appear to be able to hear me just conversationally.
Yes.
Okay, so I'll have you close your eyes.
Okay.
To start, I'm just going to make a couple sounds with my hands. I want you to tell me what side you hear it on.
Okay. Right side. Left side. Right side. Right side. Left side. Left side. Left side. Left side. Right side. Middle. Top. Front, bottom. Right side, back.
Very good. So I have another tool here. This is called a tuning fork.
Okay.
I'll just make a very small sound with it. You probably won't be able to hear it from this distance, but when it's next to your ear, you should hear it, okay? I'm sorry, when it's next to your ear. Can you hear that?
Yes, I can.
Can you hear that?
Barely.
Louder
Yes.
now?
Yes.
Good. Can you hear this?
Yes.
Now?
Yes.
Louder now?
Mm-hmm.
Good. Just tell me what side you hear it on.
Left side. Right side. Right side. Left side.
Very good. Just tell me if you hear this equally on both sides.
Yes, I do.
Okay. So I have another tool here that's going to produce a vibration sound.
Okay.
And this is going to test your hearing field. So I'm going to move this pretty far away, pretty close. I want you to tell me when you hear it further and when you hear it closer, okay?
Okay. Okay. Close. Close.
And now,
Farther.
good. Now,
Closer.
now,
Farther.
good. Now,
Farther. Farther. Closer. Closer.
okay. So directional hearing, what side is this?
Left side.
And now,
Right side.
now,
Right side.
and now.
Left side.
Where do you hear it now?
Front.
Now,
Farther. Front.
now.
Over the top.
Very good. Okay. So I am going to whisper a couple words in your ear. I want you to repeat them after me in a series of 3, okay?
Sure.
So I'm just going to include this side.
All right. Apple, cat, television.
Good. Let's do that again.
Okay, cell phone, cleaner, bottle top.
Good. So I'm going to do that on the other side.
Sure. Orange dog poster. Clock, top, bottom.
Good. So now I'm going to do that with a series of numbers.
Okay. 57, 1, 137.
Very good. So one more on this side.
Okay. 32, 17, 61.
Very good. Okay. So seemingly no issues with your hearing. Is any of that particularly difficult for you to hear? You were able to make everything out okay?
I was able to make it out just fine.
Okay. Okay, James, so lastly, I'm just going to use this tool to gently blow a puff of air into either ear.
Okay.
I want you to tell me if this is causing you any pain, okay? So you might feel a slight vibration,
Right.
your eardrum moving, reacting to the air.
Okay.
You shouldn't feel any pain, tingling, burning, anything like that. If you do, please let me know.
Okay.
Does that feel okay?
It does. Just feels like air.
Not painful at all.
No, it's not.
Can you tilt your head back for me like this? Still nothing?
No, still the same.
Okay. So I'm going to do that on the other side. Any pain?
No pain.
And tilt your head back for me. Still no pain.
No pain.
And you are able to hear this, okay?
Yes, I can.
Very good. So there's no indication that there's any damage that's been done to your eardrums, okay?
Okay.
All right, so we can go ahead and move on. Why don't we do a heart assessment?
Okay.
So I'll just be taking my stethoscope here and I'm going to listen to various ports of your heart.
Okay.
She doesn't like the stethoscope. Okay.
It's too shiny.
So just breathe normally for me. Breathe in deep and out. Good. Okay, so heart sounds normal. I will listen to your lungs in a little while when I have you turn around and I take a look at your back.
Okay.
Okay. So just doing a very brief abdominal assessment. I'm just going to do some palpations. I did see that you had a bowel movement last night. Any pain or discomfort in your belly?
No.
No bloating? Any abnormal symptoms? You said you weren't experiencing any nausea. So abdomen is soft, not distended. I'm not feeling any excess bloat or any signs that you're not tolerating your food well. Very good. Okay, so no issues there. Okay, so let's go ahead and move on. Why don't I check your skin, nails, and capillary refill?
Okay.
So I will start with this side. Just a little bit of cat hair, that's okay. Skin appears dry. Flip your hand for me. Good. Very good. Okay, so I'm going to check your capillary refill. So I'll have you turn your hand for me. Just applying a gentle pressure to the tips of your nails. Allows me to include blood flow and check for normal returns. I'm going to have you hold your hand like this. Cap refill is less than 1 second, which is great. Let's do the same on this side. Good. Same thing, hold your hand like this for me. Very prominent fingertips. Good. Okay. Now I'm going to check for any clubbing of the fingers, which I'm not suspecting, but if I could have you hold your hand like this. So there you go. Very good. Okay, good. So no signs of clogging there. So let's go ahead and move on to check some of your reflexes. So I'm going to use my reflex hammer, and I want you to just relax your arm, all of your weight onto your leg. Now we're going to slightly, there you go. Good. Now if I could have you hold your hand the same way you did before. Very good. Now turn your hand out for me. I want you to just look straight ahead, ignore what I'm doing. Good. Okay, so let's repeat that on the same test on the opposite side here. So just place all your weight. There you go. Good. Sorry, I know that's uncomfortable. So we'll do this. There you go. Slightly. There you go. Now hold your hand up for me. Perfect. Now same thing, look straight ahead and ignore what I'm doing. Good. So now I'm going to be drawing a letter or number in your hand. Okay. Eyes closed, I want you to tell me what it is. Good.
I. L.
Close. That was a number 7.
P. D.
Good.
H.
Good.
W. N.
Okay.
P or Q.
It's a number.
One more time. 9.
Good. Okay, so you did struggle with that just slightly. You were rotating the letter, so it was a letter Z. You gave me W and N, which technically qualify, but
P, Q, 9. They're very similar.
Okay. So I will consider that a passing score.
Thank you. Plus also people start their numbers and letters at different points.
That is true. So I am going to test some flexion and extension. So what I'm going to have you do is extend your arms completely out in front of you. Good. So elbows straight. Good. Close your eyes for me. Perfect. You can open your eyes. I want you to flip your hands with coordinate for me. Bend at the elbow. Now pull towards you. Don't let me pull away. Push towards me. Don't let me push in. Good. Keep your hands just like this. I'm going to pull your thumb. Don't let me. I'm going to push it. Don't let me. Don't let me separate your fingers. Now separate your fingers. Don't let me close them. Okay, so let's do the same thing with your head. I want you to rotate towards me. Don't let me push you back. Other side. And down. And back. Tuck your chin. Don't let me push you up. Push up. Don't let me push you down. Good job. Do some jaw testing here. So open. Don't let me close. Close. Don't let me open. Squint your eyes real tight. And now open. Don't let me close. Can you puff your cheeks for me? Good job. So now let's do some muscle testing. You can open your eyes for this. Can I have you smile, no teeth? Smile with teeth. Smile just top. Can you do just bottom? Good. Sad face. Good. Okay, now angry brows. Good job. Okay. Thank you. Just testing the various muscles in your face. Okay. So I'm going to briefly test some lower extremity mobility. I'm not super worried about this as you have been ambulating to the bathroom. So if I can just have you extend your leg. Don't let me push down. Don't let me push. Good job. Push down like you're driving and push back up towards me. Good job. Let's do the other side. Just don't let me push down. Push down. Good. Push down. Push up. Very good. Okay. So I'm going to test the reflexes in your knee. Good. Good. Okay. All right, James. So all of that was okay. Let me do a quick update on my notes here.
Sure.
So I'm going to give you a +2 for ambulation and gait based on what I've heard from your nurse. Okay. Alright, so let's do a couple tests for your corneal reflex. So I'm going to have you start with eyes wide open. Don't force it, but react normally as I touch your eye. Good. Now eyes closed. Okay, eyes open. Good. Okay. I'm going to repeat that same test with a different object. So we'll start with eyes wide. Very good. Eyes closed. Good. Eyes open. Good. Okay. I know that's uncomfortable, but it's important to test the reflexes in your eye. So I'm going to repeat some reflex test with a very small reflex hammer here. So I'm just going to do some tapping around your eyes.
Okay.
Keep them open, but very lazily, just kind of gently open, okay? Very slight overreaction on this side, possibly related to the lag in pupillary reflex that I saw yesterday. So just secondary to that finding, I'm going to do a brief brushing of the lid with this very small tool.
Okay.
So just keep your eyes open for me. Just trying to see if this is a lack of muscle tone here or if this is something that could be related to your accident. Have you noticed a delay in this eye before?
Slightly. I believe so.
Prior to the accident?
Yes.
Okay, very good. So a little bit of tear production. So I'll go experiencing before, then it's likely not related to your accent, but it is something that we would like to keep on file.
Okay.
Let's move on to some cerebral assessments or cognitive assessments here. So I'm going to have you do a nose to finger test.
Okay.
So I want you to start with your finger, touch your nose, touch my finger, follow my finger as it moves. We're going to do nose to finger over and over. So
Okay.
nose, finger, nose, finger, quickly, nose, finger. Good. Very good. Okay. Let's test some fine motor skills here. I'll help you with that.
Yes.
Is that better?
Yes.
Okay. So I want you to flip your hands on your lap slowly first. Good. Quickly. As quick as you can. Okay, very good. So now I want you to hold your hand like this. I will do the same. Try not to let me pull it away. Good. Other hand. Same with your thumb. So we'll do thumb and index finger. Good. And other hand. And now pinky and ring finger. This side. Very good. Good. Okay, so just testing your strength and dexterity there, and you did very well. Okay. So I want you to squeeze my fingers harder, 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 harder. Good. Do a quick Babinski reflex. If I can just have you extend your feet for me. Okay. Good. All right, James. Well, the last portion of our exam is going to be a back and lung assessment. So I do need you to either turn around or you can walk around the table and face back towards me.
Okay. I'll turn around.
Alrighty, James. Are you comfortable?
Yes, I am.
Perfect. So I just have my Penlight here. I'm going to start with just a visual assessment of your kind of head, neck, back.
Okay.
So just right off the bat, I am noticing a little bit of excess dryness.
Yeah.
Actually appears that you might have eczema. Are you aware?
Yes.
Okay. So I do have a cream that I can get you ordered for that, obviously separate to your car accident, but if that's something you're interested in, I can have your nurse bring it in for you. Other than that, I'm not seeing any obvious signs of misalignment.
Okay.
You're sitting up straight, shoulders are aligned equally here. I'm not noticing kind of leaning one side to the other. Okay. Just having a brief look at your head. You said your headache was about a 2. Was it this side?
Yes, it is.
Okay. Kind of side of the neck here.
Yes.
I'm going to do a little bit of palpating, and I want you to tell me if there are any areas that are seemingly sore than others. Does all of this feel okay?
Yes,
Does
it
it
does.
feel the same pressure on both sides?
It does feel the same pressure on both sides.
Okay, no kind of increased pain as I palpate around your shoulders.
No.
Can I have you push up for me and don't let me push down? Very good. Okay. So I'm going to do some palpating of your spine, and I want you to let me know if any of this causes you any pain or discomfort, okay?
Okay.
So just kind of putting some even pressure on different parts of your back, looking for any signs of distension or possible dislocation, any herniation of the discs in your back. Obviously, all of that would be a common occurrence with a motor vehicle accident, so definitely something that we want to rule out. Good, so all that feels pretty even. So now I'm going to be pushing on your back like this with my hand. Does this hurt at all?
No, it doesn't.
Okay. So this is just testing for any organ dysfunction. If I apply pressure, like say to your kidney area, if you're feeling any pain there, I definitely want you to let me know. Does that cause you any pain?
No, it doesn't.
So I'm going to take my stethoscope and do a lung assessment. Okay, so just breathe normally for me to start. Breathe deeply. And out. Again. Again. Good. So I'm going to touch your back with the stethoscope. I want you to say 99.
99. 99. 99.
Good.
99.
Good.
99.
Good.
99.
Good. So I'm going to palpate with my reflex hammer. Just breathe normally. So nothing notable there. So I'm going to do some brief reflex testing on your back. I want you to just react naturally, okay? Good. Seeing some minimal lateral spine movement there, just as a reaction to the sensation on your spinal cord. Good. Okay. I'm going to do a quick sense of vibration on your spine, testing for any spinal cord injury abnormalities. Can you feel this here?
Yes.
Tell me if it feels any different going anywhere down your back.
Okay, it feels a little colder, but other than that, it feels the same.
The sensation feels the same?
Yes.
Same here.
Correct. Same.
And along your scapula here, same?
Yep.
Perfect. Okay. All right, James. Well, I will go ahead and have you turn back around so we can finish up our examination, and we'll discuss what's going to happen tomorrow, okay? All right, James. So essentially we are done with the examination today.
Okay.
Everything looked normal. I didn't notice any decline since yesterday. I do need to keep you for another night of observation. So tomorrow, like I said, is going to be your sensation test. I know you were wanting to go home today. I'm sorry.
Yes.
I do think it's important that we do the full body sensation tomorrow so that we can
Okay.
rule out any neurological deficits. That's a big part of car accidents,
Okay.
especially because I did go ahead and diagnose you with that concussion yesterday.
Right.
So it's important that we get all of that ruled out for you, okay?
Okay.
So it'll just consist of me testing multiple parts of your body with different tools. It's brief, it won't take all day, but we do
Okay.
need to get that done before you go ahead and go with your discharge, okay?
All right.
Okay. So we'll stick to the Tylenol for tonight. You do have a couple of the PRN doses if you need anything extra.
Okay.
If for whatever reason you're in any excess pain, the nurse can call me and we can order you something more.
All right.
Okay?
Yep.
Do you have any other questions?
No, I don't think so.
Okay. So for tonight, independent up to the bathroom.
Yeah.
Call for the nurse if you need help, but I'm not going to have them come in and bother you for it.
Okay.
Vital signs Q4 still. Okay?
All right.
All right. Thank you so much. I will give her back to you and I hope you have a good night.
Okay.